All right, so we got kind of cut off, and I'd like to sort of pick us back up where we were. So I kind of left us off talking about that exposure. So the longer the exposure, the higher the doses of that exposure, the more serious the harm could be, right? So there's a difference between having a drink, one time versus having multiple drinks, right? Versus having multiple drinks over an extended period of time, right? Now, it's important to note that just because I had one drink, the idea that, well, I just had one drink, nothing will happen, that's not true, right? Because again, kind of going back and taking a look at this developmental progression, even that one drink actually can influence the development of the embryo, right? Because we're in the embryonic period here. Very, very, very important. Okay. So what are some teratogens and prenatal environments? Maternal diseases that could happen if a mother contracts rubella while she is pregnant. This has been related to children born with blindness, deafness, cardiac abnormalities, and mental retardation. The most sensitive period seems to be during the first trimester, so these effects seem to be most profound if a mother was to get rubella during that first trimester. Toxoplasmosis, found actually in cat feces, can be extremely dangerous to a developing fetus, developing embryo and developing fetus. If you get pregnant, most often when you go to your OBGYN, they will ask you whether or not you have a cat. And the reason why is that toxoplasmosis is often found, as I said, in cat feces. So you will be asked actually not to clear out the litter box of your cat. The reason for this is if you contract toxoplasmosis, for the mother, it actually doesn't seem like that big of a deal. In fact, you probably might just kind of chalk it up to just some sniffles, right? So you might have some mild cold-like symptoms, but for the child, this can actually result in birth defects, so severe eye and brain damage. If that exposure is within the first trimester, it's entirely possible to have a lot of these issues. It can actually also influence miscarriage in later pregnancy during a time we probably wouldn't think that it would be so impactful. Psychoactive drugs. We're going to talk about fetal alcohol syndrome in just a second. Mothers who smoke, that this has actually been linked to SIDS in children, sudden infant death syndrome, ADHD once the child is born, low birth weight. There actually is effects of father smoking as well. And we actually see some of these same effects. And this is particularly if mothers are around fathers that are smoking as well. So it's not just mothers that we're talking about here. Fathers also can contribute these teratogens and these teratogenic effects to their unborn child. Of course, cocaine, marijuana, heroin, all of these things can influence the developing child. We also know that pollutants can as well. So some household chemicals and things like that. You may even see notices, not to be touched by by pregnant women, right? And there are reasons for that. Okay, so this is kind of outlining the difference between fetal alcohol syndrome and fetal alcohol effects. So fetal alcohol syndrome, children who have fetal alcohol syndrome are born to alcoholic mothers. And fetal alcohol effects are children who are born to mothers that are consuming between 1 to 3 ounces a day. So they may not necessarily be categorized as alcoholics, but very clearly the amount of alcohol does influence the development of the child. So I want you to kind of notice a couple of defining features of fetal alcohol syndrome and for fetal alcohol effects. So with our fetal alcohol syndrome specifically, I mean, when you're looking at a child with fetal alcohol syndrome, we are going to actually see facial deformities. One of the biggest ones you can notice is the upper lip, and having that very, very thin upper lip is very characteristic of fetal alcohol syndrome, and it actually also can be of some of those fetal alcohol effects as well. We also see that very wide bridge here, and that also seems to be very, very characteristic as well. The other thing that you'll notice is for most individuals, you almost see like the bridge between the nose and the mouth. If you take a look here at our children, it's almost completely flat, right? We're not actually seeing those ridges that you would with a child who does not have fetal alcohol syndrome. We also know that there are behavioral components to this as well. So hyperactivity, potentially seizures and tremors. IQ tends to be affected as well. And many of the children with FAS also seem to have poor adjustment in adolescence and adulthood. Some of these abnormalities are also carrying on to our children with fetal alcohol effects. So we still see some of the physical abnormalities, but we also might see kind of a stunting in physical growth. Again, attention issues seem to be characteristic as well, and also intellectual performance. Infectious diseases would also be teratogens that can be introduced to a child. So of course, things like AIDS, other STDs as well can influence influence our embryos and fetus. Incompatible blood types of parents. So if you have ever been pregnant, the doctor will actually frequently ask for a blood test that's done, and they'll actually check Rh factors. Okay, so we all have blood types, right? A, B, O, OB, AB. But we also have a second marker in our blood, and it's different. These are either called Rh positive or Rh negative blood. If a surface marker called Rh factor is present in an individual's red blood cells, the person is said to be Rh positive. Okay, that makes sense. If the Rh marker is not present, then of course the person would be Rh negative. If a pregnant woman is Rh negative and her partner is Rh positive, now the fetus that you're carrying could potentially be Rh positive. If the fetus's blood is Rh positive and the mother's is Rh negative, the mother's immune system may produce antibodies that will kind of attach and attack the fetus, right? Because it's assuming that it's incompatible. Now, there are some things that can be done, medications that can be taken, etc., but this has to be monitored, which is why doctors will have this be a part of routine sort of blood screenings when individuals are pregnant. Other prenatal factors include nutrition, education. Stress is a big one. So if you are experiencing a significant amount of stress while you are carrying a child, this actually can influence the child's development. So just know that it's not just what we're introducing into our bodies, but it's also in general how we are taking care of ourselves while carrying that child, right? So even the things that we eat, all of that can influence the fetus. I'd like to now sort of transition us, and this will be sort of the end of our chapter, talking about the stages of birth. So birth, when a child is born, we actually categorize birth into 3 different stages. We've got our first stage, our second stage, and our third stage. Oftentimes when you see this stuff in movies, we just see like this first stage and we're like, yeah, the baby is kind of, born. So the first stage is actually the longest. It is when we have those contractions. It's when the cervix opens and dilates to allow for the child to be born through the birth canal. The end of the first stage, we start to see, that opening of about 4 inches or so the baby can move from the uterus into the birth canal. Okay, now our second stage begins when the head actually starts to move through the cervix and the birth canal, okay? And it will finish when the baby completely comes from the mother's body. This part actually only lasts about an hour and a half. It's much shorter. This would be when, are you ready to push, right? This is kind of that climactic moment. Again, remember, most of childbirth is actually happening during stage 1. This can take anywhere from 12 to 24 hours. Usually in movies, baby's born and they just kind of cut it out and they're like, this is it. In fact, however, we actually have a third stage. This is called afterbirth. So once the child is born, we still have the placenta, the umbilical cord, other membranes that were present kind of with the child, and those also need to be expelled as well. So you will actually have you might be asked to push again, and here we've got all of the rest of this, the placenta, the umbilical cord, all of these also being expelled and detached from the mother. This lasts only just a few minutes, right? But it is part of the birth process, and it is one of the stages, which I want to make sure that we identify and that we talk about. Okay. Once a child is born, most babies are immediately weighed, right? A child will be considered to have low birth weight in the United States if they weigh less than 5.5 pounds. Very low birth weight is less than 3 pounds. Preterm infants are infants who are born 35 weeks or fewer after conception. This is only about 12% of U.S. births. And it is dependent, right, on, they've actually, I believe, kind of altered this a little bit. They actually consider children who are born, I think, anywhere before 38 weeks to be preterm. Small for date infants weigh less than they should. So they were born on time, they were born at full gestation, but they just tend to weigh less than what would be anticipated. Now, the low birth weight is something that tends to be, something that is monitored. And there is consequences of low birth weight, low brain weight, having a risk of a brain injury, right, during that childbirth, lung and liver diseases, potentially learning problems and disabilities later in life, breathing problems, right, asthma, and all of these things tend to be noted right when the child is born. And when they know a child will be born early, that this is something that doctors are on standby. So my son was born 5 weeks early, and we knew immediately. They actually had called in NICU, and NICU nurses were actually present at his birth to make sure that if he needed anything, because we really didn't know, we didn't have our last ultrasounds, we didn't know how big he was, any of those things, just in case, they were on standby and they were there right away. Now, some of these effects that I kind of talked about with the low birth weight can be reversed. Again, some of this is just really related to nutrition that the child gets immediately after being born. The bonding is really, really important as well. And they've actually done kind of massage therapy or touch therapy. So very frequently, once a child is born, they'll immediately take the baby and kind of put it on the mother's chest. And that skin to skin touch has actually been shown to be very, very, very helpful for children in terms of weight gain, in terms of bonding, in terms of mother and child, that proximity, that feeling close to one another. It also influences lactation for women, endorphins, pheromones, right? All of these things are kind of happening. The bonding, it needs to happen shortly after birth. And so frequently you'll see this as part of the protocol, right? Baby's born, immediately baby will kind of be passed over to mom to be placed on the chest. In fact, now many hospitals offer rooming in arrangements, right? So child is born, then they never actually leave your room because they're constantly there. Massaging tends to really help premature infants. And, we're not talking about like a full-on massage like you would go to Massage Envy and get, right? But, general idea, really kind of stimulating these joints, providing that tactile stimulation actually really, really helps premature infants, and it actually influences very positive development and growth. All right, so this brings us to the end of chapter 2. And of course, I'm happy to answer any questions during our scheduled class time. So please make sure you bring any of those questions with you, and we can make sure that we discuss them in greater detail. All right, you all have a great rest of your day.